So I would say the primary difference between just everyday anxiety and anxiety that I need to see a doctor is how it impacts my life. Because we all experience anxiety, and I think part of that is that fear of I don't know what's going to happen next. If I come to the hospital, what's going to happen? Or maybe, I have a new experience, such as doing a video or something like that. There's a little anxiety attached to that, but that's just part of life. And if we manage it, it actually can be pretty productive for us.
Anxiety can be triggered by just about anything, from environmental stressors to internal stressors, like internal illness, for example. And it depends on the person, how they experience life, what will cause them anxiety.
The patient that comes to mind is a female patient who has been to our unit on numerous occasions and struggles a great deal with anxiety. Her anxiety, it's interesting because she expresses it behaviorally. I mean, she actually rocks, she rubs her legs, she struggles with just being mindful in where she's currently at. She's always anxious about the future and the things that she potentially can lose if she continues to come into the hospital. And so if she just started to get a little anxious, she would do much better if she recognized it and started some deep breathing techniques. But if she kind of ignored the symptoms of, like, I'm starting to get anxious, and then she would increase, we actually did another technique that I call bilateral stimulation, which is just a simple tapping, and you can tap on your legs where she liked to rub, so that was pretty easy of getting her to tap left, right. And that worked really well for her as her anxiety. If she was like at a 6 or a 7, she could utilize that technique.
Anyone coming into the hospital can experience anxiety, and I think one of the main causes for that is a feeling of lack of control. When you come to the hospital for whatever reason, you're giving your care over to people who may be unknown to you, and you have to develop some level of trust with your care provider to feel safe.
So in this particular session, when I was meeting with her, her anxiety happened to be at an 8 when I had her rated. After she did the bilateral stimulation, she was able to get it down to a 3, and then we had her do the deep breathing exercise, which then moved it down to a 0 for her. So that gave her confidence that she could manage her anxiety on her own because we had given her some skills.